Have you ever noticed that original Medicare doesn't have dental, vision, or hearing benefits? Oh, they'll cover certain things, especially eye care if you've got a disease or injury to your eye. But routine stuff, well, they're not covered by Medicare. Have you ever wondered about that? Well, some folks in D.C. have decided that they're going to be pandering to the voters because, we got election year coming up next year. And so they're going to pander to the voters by adding a benefit to Medicare, dental, vision, and hearing. Well, isn't that a great thing? And not necessarily. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, when has anything that's come out of D.C. actually benefited people? It never seems to work out the way they say it will. We had Obamacare a few years ago that was supposed to lower health care costs, and all it's done is raise the cost of health care and the cost of health insurance for most folks unless they qualify for a subsidy because they're low-income people. Everybody else is paying double or more. And then when they came up with the drug plan, everybody needs a drug plan. Well, guess what happened? Once the drug plan went into play, prescription drug prices started increasing dramatically. A lot of the patient assistance programs that were available to individuals because their medications, they were taking a brand name drug, it's usually pretty new, and those drug prices were pretty high. Well, a lot of those patient assistance programs went away because of Medicare Part D. So, it seems like every time they try and fix something, they make it worse. That shouldn't come as any surprise to anyone that has looked at what the folks in D.C. do from time to time. Okay, so what's wrong with dental, vision, and hearing benefits? Well, okay, first off, there will be a premium associated with it. I don't know how much, but you're already paying a Part B premium. You're paying a Part D drug plan premium. And so all of a sudden, if they add on this other stuff, they're going to be paying a premium for that. And you're saying, okay, well, that's okay because at least I'll have this kind of coverage. All right, there's a catch to it. There's always a catch to dental, vision, and hearing benefits especially. And the catch is you have to find a provider that's willing to take that plan. And it's almost impossible. I mean, over 80% of dentists do not participate in any dental plan. And there's a lot of reasons why, but just understand that if you had dental insurance, you got a 4 in 5 chance of not finding somebody who will take it. Vision plans, they're not as popular out there, and neither are hearing plans, hearing aid coverage. But a lot of those also, they'll only cover certain glasses. They'll only pay or contacts. For the vision side, on the hearing side, well, we'll pay $500 towards a hearing aid, but not anymore. And by the way, you have to go to certain dealers. Well, if you're talking about a hearing aid that's $2,000, $3,000 or more, and some of the better ones that really work are, how much do you want to pay for hearing coverage, hearing insurance, if it's only going to pay $500? And you've got to find somebody that takes the stupid plan. So, just letting you know, giving you a heads up, everything all that glitters is not gold. And so if you see something about folks in D.C., well, we want to help you out. We want to help out the seniors on Medicare. Now, keep in mind, these are the same folks that said, well, we're struggling to find ways to save Medicare. But in the same time, out of the other side of their mouth, they're saying, but we want to add more benefits. Where does that make any sense? All right. Well, this is my gripe moment for the day about the folks in D.C. that they're just pandering for votes. They're not really accomplishing anything that will help. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.